Welcome to Deuk Spine Institute live stream. Our patient here has cervical facet joint pain. It's the second most common cause of neck pain. Accounts for probably 10% of all primary neck pain and certainly is present in about 40% of patients with chronic neck pain. So it's the most common secondary cause of neck pain following a disc problem. Shot. And we are going to be treating his facet joints with what's a procedure called the Deuk plasma rhizotomy. This is a rhizotomy, and like all other types of rhizotomy, the goal is to deaden the pain nerve to get pain relief. What's causing the pain? Inflammation within the facet joint. The facet joint is a small joint in the back of the neck, and we all have facet joints, all of us. They move mostly when you rotate your neck. They move and they slide on each other when you're rotating. I could feel exactly what I need to feel, them tapping on the bone right where the pain nerve is. Now I made the incision a little lower than his upper part of what we're fixing, but I'm fixing, basically I'm doing 3-4 as well, just because I don't want him coming back with a problem at 3-4, and then we're going to go to 4-5. Now, other doctors will perform what's called a radiofrequency ablation. In a radiofrequency ablation, the problem with that procedure is it doesn't last and it doesn't really work. So at Deuk Spine, we've changed the technique where we use a probe that delivers more energy, and we are able to wand the probe. Wanding means moving, and we're actually moving the probe around to make sure that we destroy the pain nerve. You see, the pain nerve exists in an area of the spine that we know where it is roughly, but we don't know exactly where it is. Where the lateral mass waist is on the lateral side. So let me show you what I'm talking about. If you take shot, if you look at the x-ray there, the tip of the probe is just below where this nerve normally lives. Jordan is showing you where the nerve normally lives, and we don't know that his nerve is there. So what we need to do is we need to treat the whole area, shot, so that if the nerve doesn't happen to be exactly where it's supposed to be, and it happens to be a little bit to the side, we're going to get that nerve and kill it. It's a pain nerve. It does no good for the patient. The name of that nerve is called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. Now, many of you watch our procedures being done on patients, and patients have no pain afterwards, but this procedure is one where you will have pain after the procedure, because we're actually burning the nerve, but there's always some muscle nearby that gets burned as well. Any questions?
At this moment, no current questions.
Fine. After we're done here, we're going to move on to his disc. He has 2 discs in the neck that need to be fixed. We'll be performing the Deuk laser disc repair. But right now we're treating his shot painful facet joints. Shot. shot. I got probably another few minutes, 2 minutes, doctor, and then we'll be done with the Deuk plasma rhizotomy. We'll move on to the Deuk laser disc repair. Shot. And once again, I'm essentially destroying the pain nerve where it's supposed to live, where it's supposed to be, which is right in this area of the bone of the spine. We can't see the actual pain nerve, but see where the tip of that probe is? That is in the perfect spot for where the pain nerve lives. Hopefully we're destroying it satisfactorily. We never know until after the surgery's over, and then the patient will tell us if we got it or not. But good news, we've done a lot of these procedures and we've had some excellent success. There's the next spot right there. It's perfect. You can actually feel the nerve with the tip of my probe against the bone. The nerve has a certain feel to it, and that was a big one. Typically when the nerve is enlarged like that, it means it's being used, and since it's a pain nerve, it means it's being used for pain transmission or transmission of pain signals. So believe it or not, it's quite interesting. The human body is able to adapt to stress or use by a process called hypertrophy. And in the case of his facet nerves, they are, in my opinion, hypertrophied. All right, just about done. 1 minute left, shot. See, I don't feel a big pain nerve here. Not like the last one. But I did feel a small one and I just transected it. That's good. Shot. All right, we're done.
Sitting down, please. Thank you.
Hopefully that helps this patient. Let's show you guys the incision. Let me have a Raytech. The incision is tiny, 4 millimeters. You guys see this?
Yes, we do.
Just a little tiny incision. All right, let's put the staple on. And you guys go ahead and get the gurney in. I want to peel this off first. We're taking all the drapes down because we're going to flip this patient over next and do the Deuk laser disc repair, which is the disc surgery that he came here for. We discovered his facet pain when I examined him in clinic. But you guys saw, wipe please, how small it was, right? Thank you. All right, any questions?
Yes, we have a question from AJ on YouTube.
Sure.
First question they asked is, hey, Dr. Deuk, I'm a former thoracic patient of yours. I have a question regarding cervical herniation. I have numbness and tingling in my left pinky ring and a C4-5 herniation. Is the herniation that is causing my fingers to go numb, or would it be from another issue?
Yeah, it's a great question, AJ. Normally it would not. The ring finger and pinky is normally C7, which would be a different disc. So something doesn't add up. You may have ulnar neuropathy, which is a pinched nerve in your elbow. You need a nerve test to be done to make that determination. So I recommend a nerve test, EMG, nerve conduction study, and it sounds like you've got ulnar neuropathy. And then maybe do a free MRI review with me so I can give you a diagnosis. Any other questions?
At this moment, no current questions.
All right, we can end the broadcast. We'll be back shortly with the cervical Deuk laser disc repair where we go in and repair the disc.